Everyone, welcome back. June is Men's Health Awareness Month, and this morning we're breaking down what health screenings men need during each decade. Primary care doctor Don Alvarez from Luxe Primary Practice is here with us this morning to talk more about this. Good morning. Welcome back. Thank you so much for your time.
Well, thank you for having me, Zach.
We do appreciate it. Hey, I want to ask you, as we get this conversation started, why are men known to be so bad at going to the doctor?
Well, that's because we're men.
Yeah, right?
No, but so a lot of things that actually my patients tell me and their wives is, that men, we just feel that we're really busy. We're, the providers, so it's a little more difficult for us to take time off to come in and, really address our medical issues. Another thing is really, some of us are a little hesitant about knowing what's really going on. Right. So
that fear.
If it's not there, if we're not feeling anything, we're like, okay, we're fine.
And if you're not telling me the truth, if you're not telling me that this is what is happening, then it's not happening.
Then it's not happening, exactly. Right. So I think it's a lot of that kind of sweeping things under the rug sometimes, and just to keep going.
Yeah. Yeah, it is fascinating, but we're having this conversation because men, you have to get to the doctors. You have to do this, whether it's an annual physical, maybe that's a good way to start, right? Or if there is a problem, having these conversations and going to get them checked out. With that, let's talk about health screenings for our younger men, 18 to 39. What screenings are for those guys?
So from 18 to 39, really, it's more focusing on going in, getting your physical exam done, blood work, and talking about your family history, talking about, habits that you have, because that's really what we're trying to change early on, right? Building good habits that are going to have an effect long term. So when you come in, you get blood work done, you get your cholesterol checked, you get your blood pressure checked, get diabetes screening, like your blood sugars, kidney, liver, blood counts. There's a lot of things that we check, on the annual blood work. And then, also going over vaccines, making sure that you're up to date with your tetanus vaccine, your flu vaccine, COVID vaccine, those types of things. So really, it's to just kind of sit down and risk stratify patients. If you have issues that run in your family, right? Well, we want to, address those issues and come up with a good preventative plan for those. But really, in this age range, it's more focusing on habits.
And overall comprehensive wellness.
Yeah.
Having those types of dialogues.
Eating clean, eating healthy, exercising, those types of things.
And of course, if there is an issue, bring those issues up. Talk about those things. Okay, for men between the ages of 40 and 60.
So in this population, that's really where we start focusing a little bit more on, on the preventative screens that we hear about. So colon cancer screening, right? Actually, before it was, we were supposed to start at age 50. Now it's recommended we start at age 45, or even earlier if you have any risk factors like family history of colon cancer. If you yourself have any issues like inflammatory bowel disease or those types of things, we start earlier, right? Then there are other things like prostate exams, for example, that are really kind of more based on, your personal and family history. But that's something that you really need to discuss more with your doctor, because screening guidelines for prostate exams have actually kind of gotten a little more lax over the past decade or two. Whereas before we were very aggressive, everybody get a PSA, everybody get, the rectal exam. Now, we're a little more lax about those things, because we found that a lot of men were having biopsies and things like that, and it really didn't change outcomes.
Interesting.
And cardiovascular disease is another big thing that we need to address during those visits. Blood pressure, cholesterol, getting and risk stratifying you. So if your heart attack risk is greater than 10% over the next 10 years, then possibly putting you on medications in addition to lifestyle modifications. Those types of things.
Interesting. With the prostate exam, I want to go back to that for a moment. I saw 55. Is that still the age, or is that younger now? Well,
so again, that you really need to talk to your doctor about that, because, I mean, depending, some men really you shouldn't even do PSA testing on.
Okay, interesting.
Right, yeah. So that's a conversation you need to have with your doctor to really see what you're going to do moving forward.
For men 65 and older,
Well, so, I mean, you can start at age 50, 55. If you have a family history of prostate cancer, for example, and in that case, yes, you do need to start, you know, or earlier, and you do need to get checked.
Yeah. For health screenings for those 65 and older.
Oh, sorry. Yeah.
Yeah.
So for 65 and over, that's really where we start, where we continue what we were doing before with colon cancer screening, you know, prostate screening if appropriate. But we're also shifting our like preventative guidelines to things like falls, for example, right? Because a lot of complications can come from falls. So focusing on you know, making sure that patients are safe at home, are strong, you know, have good coordination, making sure patients aren't at higher risk of osteoporosis, for example, because if you fall and you have weak bones, you're more prone to fractures, which has a whole slew of complications. So osteoporosis screening is important. The other big thing that I talk to with my patients 65 and over is end-of-life, you know, decisions. So
just having a plan.
Exactly, because these are difficult conversations that people don't usually have with their family, right? Because it's difficult to talk about. But it's something you do need to talk to your primary care doctor about, you know, to get your wishes down. Because in training, there were a couple of times where I was in the hospital, and you know, I saw families needing to make these difficult decisions.
It's heartbreaking,
and it can really bring up friction between family members. So talking to your primary care doctor about this is very important too.
All good information. And for men who are watching right now and they're like, man, I don't even have a doctor, where do you suggest they start?
Well, you know, your primary care doctor should really be your home base, right? So any medical issues that arise, preventative screen, medical questions. I mean, you should be able to talk to your primary care doctor. So finding a primary care doctor that you connect with is very important.
It's key.
It is, because the whole thing with health is about being proactive rather than reactive. And that's where the screening guidelines, all this comes in, being proactive about your health so you can address issues before they become big problems. Catching things early, you know, it's a lot easier to treat something when it's barely starting than once it's gotten out of hand. So like the way we kind of handle this in our practice is we have meet and greets. So, you know, we sit down, we talk to patients, you know, they interview me and I interview them to see if we are a good fit. Because you want to be sure that you can talk to your doctor about these types of sensitive issues.
That's a really great opportunity. And we so much appreciate you coming by and chatting with us.
Thank you,
Dr.
for having me,
Alvarez.
Zach.
Absolutely.